This is the Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today I'm here with Harvey Castro, author of the book ChatGPT and Healthcare. ChatGPT and Healthcare is a call to action for anyone looking to improve healthcare access and drive change in the healthcare industry. Harvey, thank you for joining us.
Awesome to be here. Thank you for having me.
Where are you calling from today?
I'm in Dallas, Texas, so not too far from you.
That's right. We're here in Austin, so we're on the same I-35, but glad to connect with you today. Before we kick off, let's talk more about your background. What did you do before this?
Yeah, I'm a ER board certified physician and serial entrepreneur. So before this, I pretty much feel like I've done a little bit of everything from creating my own vitamin label to over 30 iPhone medical apps to having, this entity, the freestanding market. I created over 20 freestandings in the state of Texas. My recent one was called Trusted Medical Centers. We had 8 locations and I sold all those a couple of years ago.
Well, great. Well, you wrote the book, ChatGPT and Healthcare, and just wanted to see what inspired you to write this book.
Yeah, it's a good question. So literally let me go back to my story. I was in the emergency room, literally had my first iPhone, and I was coding a patient. And at the time, I noticed that the nurse, when I asked her for certain medication, she basically had to go through a textbook, thumb through it, find the medicine and give it. And I thought in my mind, there's got to be a better way. So I literally created the first iPhone IV Meds app in the world, and it was called IV Meds. And the reason I like sharing that story is because fast forward many, many years later, that was the iPhone 1. Obviously, I think we're at the 14 now. And I was playing with ChatGPT, and I think I lucked out. I happened to be playing with it just when it first came out. And when I was playing with it, I thought, this would be a great tool in healthcare. And I got so excited that I literally started writing a book about how could this be used in healthcare. And literally, I got it published by January the 3rd, 5th, somewhere in there of this year. And so my passion in healthcare and technology is huge. And I thought this would be the perfect tool that I can help teach patients how to use it and then teach other doctors and professionals how to use it.
Great. Can you tell us more about the book? What exactly do you cover in it?
Yeah, the first book, it's kind of 10,000 feet high. I'm going over different applications from like clinical trials, patient education, how doctors should see it, how patients should see it. It's, like I said, really 10,000 feet high. The second book, I really go into the weeds of kind of going through screen by screen, how it can be used. And then I go through all what I call the good, the bad, and the unknown, meaning there's things that ChatGPT can do that if patients don't realize can cause harm. And so I go through all what's obviously called the hallucination effect and go into the ethics and biases of it. So there's just so much material to cover. But the way I see it is every month I feel like I want to add more. So instead of adding, I end up finding another area that's brand new. For example, ChatGPT 4 came out. And I'm literally working on the cover. So my goal is to have a book out next week that covers all the different databases that are coming out, like Bard and GPT and Bing and all these other things that are out there that's going to influence healthcare.
Great. Well, who is the primary audience for it?
Yeah, good question. Honestly, some of the books, the way I wrote them, are different facets. Big picture, I write the first one mainly for doctors, the second one for any type of patient. The third one is more of a healthcare / weight loss, biohacking your weight. And I use it for those individuals that are trying to lose weight to help them use ChatGPT to leverage that power in losing weight. And then I become addicted to this. So now as a serial entrepreneur, I thought I need to have a book on entrepreneurship. So I literally this last week, I released a book on entrepreneurship.
Oh, great. Well, it looked like the book could also be used by those that are developing ChatGPT products for the healthcare industry. I saw a lot of applications and how it could be used, and I thought that would be very helpful to those building the systems. Are you targeting them in any way?
Oh, yeah. I think my wife will say I'm nerding out in the book, and I talk about a lot of geeky things that are probably really advanced, but I honestly write it for those people that are programming or thinking about doing these kind of things. I'm trying to merge. It's really hard. Everyone's vocabulary or in this entity varies. Some people get it. Some people never heard of it. And then try writing a book to all the different audiences. It's tough. But at the same time, it's interesting because I'm getting critique from people that are very advanced saying, oh, this is so simple. And then I'm getting other people that have never heard of this saying, wow, this was, somewhat above my head, but enough where I learned so much. And so just finding that right audience for the different things. And then the other part is this technology changes so fast that as every time I'm about to submit the book for publishment, I realize, oh, wait, this just came out today. And so then I start pausing and let me add this. And so then I finally said, okay, I just got to draw a line in the sand and say, just go for it. And if a lot changes, then I'm encouraging people to follow me on LinkedIn and social media so I can kind of educate them that way.
Well, as you look at ChatGPT, what surprised you the most about it in applying it to the healthcare space?
Honestly, it's kind of scary and good in a good and bad way. I'm really shocked at what it can do. And the problem too is the latest edition, ChatGPT 4, has been released up to a point, but the point of adding what's called uploading information and doing that for the general public, it's not there yet. And so big picture, what surprises me is the ability, and I want to test it. But for example, as an ER doctor, I see a lot of patients, unfortunately, that overdose. And sometimes when they come in with a few bottles, pills in their bottle and different bottles, but they take the labels off and they don't want anybody knowing. Well, it's hard to find out. So it takes me a bit of time to figure out what pill they were on, look at the code on the pill, call poison control, and then figure it out for the patient. I see, and no one's talked about this. I think I'm the only person that, since I'm an ER doctor, that talks about this. I see a feature where pretty in the near future, like I think in a few months, where you could take a picture of the pill. The database will recognize what pill it is or pills. It'll go into a poison controlled database and then spit out a result saying, okay, this patient took XYZ. This is the antidote. These are the symptoms to look out for. This is the amount of time you need to watch the patient. And it'll give me that within seconds, as opposed to the traditional way right now that is taking hours.
And after you did all this research and worked with it for a while, what was the most important takeaway you found in it?
The best profound one for me has been, honestly, this sounds weird, but I use it as a person I can talk to about just kind of like brainstorming. So any brainstorming session, and I call it a person because I go in and have an idea and I start working with ChatGPT. I use the 4th edition because it's more accurate and tends to have less hallucination. And that's how I use it. And I love that feature because I feel like I'm way more productive, able to do more, see things, and I'm using my creativity, combining it with the power of ChatGPT and coming up with something more than I would have done by myself.
Oh, great. Well, your book covers a lot of different application areas like clinical decision supports, clinical trials, remote patient support, telemedicine, and more. It seems like it's very expansive. It seems like it could do just about anything. Where do you think it's going to fit best?
I think the first edition or rendition of this, one of the issues is this thing called hallucination, meaning that it can tell you half truth and half false and you don't know. And so right now in healthcare, I feel personally it has to be with the doctor's blessings, and it has to be the right doctor. So I keep saying I'm an ER doctor. If you give me something outside of my field, like surgery, and tell me, hey, look at this, and is this the correct surgery? I may say yes, medically it sounds good, but then if you show it to a surgeon, they may say no. And so my point is, it's not quite ready. And what it's best for, I believe, is education, but with the caveat that the doctor has to give its blessings. So, for example, if you're diabetic, hypertension, overweight, ChatGPT can give out output, and then that information can be put on your website, can put on your discharge instructions. Those kind of utility I see would be best to help our patients. As we move forward and this technology advances, I think we'll be able to do all the things that I talk about in that book about telemedicine and patient interviews. I think that is already coming sooner than later, but I think it'll be refined 10 times better when we get to ChatGPT 5 and 6.
One thing about AI systems is that they're very dependent upon the data sets that they get to examine. Where do you see data coming from to train these systems, and how would you control it so it gets good data, not bad data?
Yeah, good question. The future is not going to be ChatGPT and healthcare, even though that's what my book is called. The future is going to be some kind of GPT. I always tell the audience, think of GPT as Kleenex. It's the first one you played with. And I really think a lot of people in their mind, they'll maybe playing with Bard or BioGPT or some other GPT, but they'll still say, oh, I was doing it on ChatGPT. Just kind of, you'd say Google, I Googled it, but you may have used something else. It wasn't actually Google. And so my point is, how do I see this in the future? How to eliminate those biases. Number one, in healthcare, I truly believe there's something called BioGPT that possibly may be the one that it's basically the data that goes into it is 100% just healthcare. And so it'll be PubMed, up to date, all the different sources that a doctor tends to use. And then fast forward, as a doctor uses it, it'll be reinforced by other doctors using it. And so now you're increasing the health IQ of the database to the point where I could say, this sounds horrible to even say, but I think it'll be higher than a human being because it'll have access to so many different databases that it would be really tough for a human being to be able to absorb all that information. And then as information keeps changing, think of this quote, every 72 days, medical knowledge doubles. And so for you to consume all of that is why we become specialists into a certain type of medicine, because we can't take it all in.
Do you think startups are going to form around vertical versions of AI that some call it vertical SaaS? It's a type of startup model where we don't try to make a tool for everybody. We make it for a specific industry, and therefore we can go deeper and more effective with it. Do you think that's how it's going to shape out here?
Oh, yeah, for sure. I'm already seeing it. It was funny because at first I thought, wow, when ChatGPT 4, the APIs come out, it's going to revolutionize what you just said. And then now GPT came out with the plugins, and I thought, man, that was genius. Okay, so fast forward between the APIs and the plugins, I think we're going to see so many things coming into this space that doctors and administrators are not going to know which one to go with.
Well, we see a lot of medical device deals come through, and increasingly we're seeing them with AI systems behind them, usually around very specific things that need to be determined. But do you think we'll see in the future a ChatGPT version for every medical device coming out for coordination, maintenance, support, diagnostics, et cetera?
Yeah, the problem with GPT in general, I see it, it's like you're having a shotgun and you may not need that shotgun for your device. And so it makes more sense to train a GPT that is particular to that subset of the market and create that vertical. Using that particular device, you could create a GPT that's only for that device. That way, for HIPAA reasons, privacy, hallucination, you have way more control. So moving forward, I do see that as the future.
So based on this experience, what are you going to write next?
Actually, this is going to sound crazy. Really, not probably maybe a little bit ADHD. You're going to laugh. I recently was the medical correspondent for Nancy Grace. I did a couple of podcasts for her, and I'm going to surprise her. I'm hoping to publish by next week the first crime book that will have GPT and crime and going over different cases using GPT-4. And my goal is to have it done, ready, and she doesn't know this, but then next week sometime, present it to her and see what she thinks. That'd be kind of cool, just to get her angle of it.
Well, great. Well, I always ask this question of everybody. It's a great way to discover new things out there. What online information source did you find most helpful in writing this book?
Yeah, going back to healthcare, honestly, the best one is just, this sounds odd, just everyone on LinkedIn, all the leaders, OpenAI, different sources. So it wasn't just one. Being able to see what different groups understand and see, and like what you mentioned earlier, there's a lot of programmers giving their thought, but then there's a lot of businessmen giving their thoughts. And then being a doctor and being able to put it all together, as I'm also a business person, putting it all together, all those sources, and then bringing it into one and creating a new idea. And that's technically what entrepreneur is. And that's literally what I'm doing with the book. So I think you'll enjoy my next book. It's going to be called Bing Copilot, and it's got a longer thing than that, but you're going to like that book because I go into a lot of ideas that no one's really thought of how to use this in medicine. And I'm sure computer engineers and people are going to get the book saying, ooh, this is a good idea. I can create this product.
Well, great. Well, if you could start a business tomorrow based on all the technologies and applications you see, what would you start that business in?
Yeah, I think it depends. For me personally, it would be focused on healthcare. and creating that different vertical for patients and specializing. For me, I personally think the top 10 diseases would be a good focus, and focusing even more would be in the top 3. And those are usually diabetes, hypertension. If you can create a product in those verticals, you're going to do well. And especially if you're combining this technology.
Well, great. Well, recently there was an announcement that many people were calling for the pause of development on ChatGPT 4 by many notable people as well who are in the space. What was your take on that?
I have mixed emotions on that because unfortunately, a lot of people will make an opinion and I take a pause. Is there a second intention there? For example, Elon Musk is one of the people that have said, hey, we need to pause this, but yet he was the one that put millions of dollars into OpenAI. And it's known that he's creating his own ChatGPT equivalent. And so, my devil advocate in me makes me think, well, if he's asking for 6 months, does that mean he needs 6 months to catch up? Or, is he using this influence as a purist saying, no, we do need to push legislation. And it's not really that he's asking for a pause, but it's his way to get the politicians involved to jump in. And I do agree that we do need to make sure that we're regulated to some degree, but not at the point that we suffer from the advancement of this technology. But with that said, I do worry that if all I need is $600 to have a GPT, then I'm worried that if the wrong hands create their own GPT, then sky's the limit in a bad way. And so they may use that technology for, I don't want to sound like a comic book, but for evil and do the wrong thing. And so when he wrote that letter, that's why I said I have mixed feelings. I do think it's the responsibility of a large corporation. And not to get too philosophical, but it's almost like having a nuclear bomb. If you're able to build that kind of technology, then it comes with responsibilities. And I would make sure that if anyone that's doing it, I would hope and pray that they're doing it with the right intent and they put the right blocks and things. For example, you would hate for someone to be able to build this and all of a sudden know how to circumvent the government, how to make their own bombs, how to create massive casualties. And they're using this tool in that manner, as opposed to OpenAI currently is doing everything they can to block those kind of things. And so, that I'm going to pose that back to everybody. It kind of goes both ways. How can we best regulate this, but at the same time, advance this technology?
Well, it certainly seemed like it came up fast. I think they announced it back in November, and even here 4 or 5 months later, it is really just taking off very quickly. Everybody's adopting it, and it is the next thing. Did you think it would be that big of a thing when it first came out?
I did. When I got to see and play with it myself, I immediately realized, and I don't think it's by accident that here 3 months in, we're already hearing about the next rendition. I personally think these individuals were sitting in a boardroom, looked at the technology and said, hey, we can't come out with this version 5 or even 6 or whatever. Say they're up to 5. We can't release this today because if we do, we're going to disrupt the economy so bad that this is going to end up hurting. And I honestly think they put the brakes on it. And that's why they let 3 out, 3.5, and then they let 4 before pseudo out, because they know that this can disrupt. And the sad part is a lot of the world, I say a lot, if you look at the percentage of the world that knows about it, it's very, very small. Yet this thing is advancing so fast. And so I think by the time the world sees this technology, who knows where we'll be. And I think those that wanted to cause a pause or wanted to make change, it may be too late. I feel like the cat's out of the bag. And this is why I wrote the book initially. I don't want, and this sounds horrible to say, but I don't want businessmen controlling healthcare. I want doctors and patients to control healthcare. And so I wrote ChatGPT Healthcare, not for the business person, not for the person running Microsoft, but to run it by a doctor and a patient. Because I think those two people will have the best in mind and will create the best tool and will not look at it from a monetization point of view, but look at more as how can it help? I think the money will come, but if you put the money first and then the patient second, to me, that's the wrong order.
Well, I applaud your effort there to put the patient and the physician back in charge of healthcare. That would be a great thing, and support you in all of that. In the last few minutes that we have here, what else should we cover that we haven't?
We haven't talked about it, but I'm I put it behind me, the social media movement in healthcare to change it. I would love to have people follow my LinkedIn group. It's called ChatGPT and Healthcare. I have no ownership other than having people in there in the sense that they're lawyers and doctors and patients. But I feel like together we can really create change. And then I'm hoping that there is a programmer out there that's in that forum that says, you know what, we're going to create this tool. And I know there's $1 million companies out there that are going to be upset, but this is going to help patients. And I'm fine with that because at the end of the day, it's a competitive market and it's just going to help drive prices down. And hopefully that'll come down to the consumer and the patients can get better care for less.
Well, great. And so where can people go to buy your book?
Yeah, my book is on Amazon, and all you got to do is type in Harvey Castro, MD, and you'll see all the books that I've written. And the nice thing about doing it that way is if I promote one book or the other, by the time you see this, I may have another book out, so you may like that one more.
Well, that's great. And so how best for listeners to get back in touch with you?
Yeah, I hate to say it this way, but I live on LinkedIn, so feel free to follow me on LinkedIn, and I'm pretty good about responding, and I'm pretty good about keeping my pulse to the media and posting anything that I see right away and kind of share with people.
Well, great. We'll put that in the show notes. I want to thank you for joining us today, and we hope to have you back for a follow-up soon.
Awesome. Thank you so much, and I hope to be back.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Harvey Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.